Good day. My pep talk today is entitled Breast Self-Examination, a Must-Do for All Filipina. The empowerment objective is for the lay people to have an essential understanding of breast self-examination as a must-do in all Filipina in their health management. The contents of this pep talk will be the following. What is a breast self-examination or BSE? Why BSE is a must-do for all Filipina? Why is screening mammogram not a must-do for all Filipina? How to do BSE? How to interpret the findings in BSE? And what is ROJoson's advocacy program on BSE? I'd like to have a disclaimer. The contents of this pep talk consist of my thoughts, perceptions, opinions, and recommendations culled from the experiences of other professionals as well as myself, ROJoson. What is a breast self-examination or breast self-exam, BSE? Breast self-examination is an examination of one's own breast, usually through inspection, meaning looking at one's own breast, and palpation, meaning touching and feeling with fingers one's own breast for anything unusual, for any abnormality, or for any disease. Why is BSE a must-do for all Filipina? BSE is a must for all Filipina who love themselves and their bodies and who are concerned with their breast well-being. I don't like to use the word wellness because wellness is just focused on physical health. I prefer the word well-being because this encompasses wellness and it includes the physical, emotional, and physical aspect of health. BSE is a must because the most dreaded disease of the breast, which is breast cancer, can strike any time, at any age, to all Filipina, young and old, as long as they are still alive until they die of other diseases. Also, BSE is a must because breast cancer is the most common cancer in the Philippines among the Filipino women, the Filipina. BSE is a must as no Filipina should rely solely or only on physicians or breast specialist examination in their goal to achieve breast well-being. Also, BSE is a must as no Filipina should rely solely or only on laboratory tests such as mammography and ultrasound, even if done yearly or every 2 years, in their goal to achieve breast well-being. And lastly, BSE is a must because it is simple to do, costs nothing, and it is the primary and foremost early breast cancer detection tool. The physician's clinical examination of the breast and breast laboratory tests such as mammography and ultrasound are secondary and should be preceded by a BSE. At present, majority of breast cancers among the Filipina are discovered through BSE and not with the physician's clinical examination of the breast and breast laboratory test. Thus, breast self-examination, BSE, is a must-do for all Filipina. All Filipinos should do BSE starting at the age when they can be taught how to do BSE and how to interpret findings on BSE. This age can start at the adolescence or teenage period. Adolescence is the phase of life between childhood and adulthood, usually from ages 10 to 18. This is the period in which it is considered an important time for laying the foundations for good health. And BSE should be done until the end or near end of life, as breast cancer can occur up to the oldest age. All Filipinas should not just rely on the physician's clinical examination of the breast and breast laboratory tests such as mammography and ultrasound, as this practice cannot be sustained because of the inconvenience and cost involved, and which will just result to an irregular and haphazard program for promoting breast well-being. Why is screening mammogram not a must-do for all Filipina? Lately, specifically August 2023, it has been reported in JAMA, a medical journal in the US, that current evidence does not substantiate the claim that common cancer screening tests can save lives by extending the lifetime of the patients. And these cancer screening tests include mammography. Screening mammogram can be done in Filipina with high risk for breast cancer, meaning they have a strong family history of breast cancer, and screening mammography should be done only on a selective basis. Not all should be done and not routine. And mammogram does not replace or should not replace the breast self-examination. The other reasons why screening mammogram is not a must-do for all Filipinas is because mammogram is associated with a lot of uncommitted readings, such as readings of viral serum needs additional tests, false positive readings, and at times false negative readings. And a lot of times, these problems mentioned above have led to undue anxiety for the patients, undue added procedures, and more expense. Thus, my recommendation is that screening mammogram is not a must-do for all Filipina. How to do BSE? To be effective in achieving its goals of promoting breast well-being and detecting breast cancer early enough if it develops, BSE must be done correctly and regularly, at least once a month. The essential objective of BSE is to look for anything unusual. If anything unusual is found, an attempt at interpretation can be done. A breast specialist is consulted early as warranted. Note it takes only a few minutes to do the BSE. And when to do the BSE? For menstruating women, BSE is recommended to be done 7 to 10 days after the last day of mens. This is to avoid hormonal swelling of the breast tissues during mens being mistaken for a dominant mass, and to avoid the discomfort induced by palpating a breast that is usually sensitive during the time of menstruation. For non-menstruating women, the first or last day of the month is chosen. It can be done during bath time or any other time. Where to do the BSE? It can be done in any private place, such as in the bathroom during bath time, standing up or lying down. It can be done either standing up or lying down. Again, take note that it only takes a few minutes to do the BSE. The first step in doing the BSE is the visual inspection or looking. Expose the upper body in a standing position, face the mirror to view the entire chest and the breasts, as shown here. With both arms down and then raised over the head, look for anything unusual on the breast. Look for changes in the contour of the breast and armpits, such as bulbs, skin dimpling, and flattening, as shown here. There's something unusual here in the contour. Look for unusual changes on the skin of the breast, such as redness and lesions, shown here. The second step in doing the BSE is the manual palpation or feeling. In a standing position with one arm raised over the head using the flats, not the tips, of two to three fingers, usually second to the fourth fingers of the other hand, gently firmly palpate the entire breast on the side where the arm is raised. Feel for anything unusual in the breast and feel for possible presence of a dominant mass. A dominant mass is an unusual density distinct from the surrounding breast tissue with a felt margin or border which connotes a three-dimensional lump. This is illustrated here. So if you have lumpy breasts, it's normal. It's what we call fibrocystic changes, usually due to hormonal changes. But if there is a dominant mass, which is defined as one that stands out, different from the surrounding tissues, if this is present, this is considered as a red flag and which should be investigated further. So always look for a dominant mass when you palpate the breast. Cover the entire area of the breast by going one quadrant at a time until all four quadrants of the breast are palpated. Example, first quadrant, then going down, lower quadrant on the other side, then upper quadrant. Okay. Like this. Until all the four quadrants are covered. Before palpating the armpit, which is the second part of the palpation, gently squeeze the nipple for possible presence of discharge. If there is discharge, note the color, whether it's red or not red. When palpating the armpit, put the arm down. This time, the arm is down. To have a lax or slack skin fold, place the palpating fingers initially at the upper portion of the armpit, then gently but firmly press against the chest wall in the armpit and slowly glide the fingers downward to feel for anything unusual and to feel for a possible presence of a dominant mass, which is usually a lymph node. After having done with inspection, with palpation of one breast, one can go to the other breast. So repeat the same procedure for the other breast, the nipple, and the armpit. How to interpret the findings in the BSc? So always take note of the difference between the lumpy breast tissue surface and dominant mass. As mentioned, the real mass is the dominant mass, and if a dominant mass is present, it is a red flag. It is considered as a red flag. So one has to differentiate dominant mass from lumpy breast tissue. How to interpret? No dominant mass found. Then, so the diagnosis is that it is normal or fibrocystic changes. If there is breast pain, but there's no dominant breast mass, then the diagnosis is still, or is also fibrocystic changes. It's still normal. Non-sanguineous, not red nipple discharge with no dominant mass, the diagnosis is fibrocystic changes. Sanguineous, red nipple discharge with no dominant mass, intraductal papilloma, a benign condition. So a red nipple discharge is more alarming than a non-red or non-sanguineous nipple discharge. Focal erythema or redness and tenderness with no dominant mass. Diagnosis is mastitis or inflammation or even infection. Focal erythema or redness with tender fluctuant dominant breast mass. Here is the mass. Okay, fluctuant. When you say fluctuant, it's depressible. Most likely it contains some fluid there. And this will turn out, because of the presence of redness, this will turn out to be a breast abscess. So the fluid inside is pus or nana. Cystic mass with no signs of malignancy, then the diagnosis is macrocyst. So when you say cystic, it means it possibly contained fluid, and the cystic mass is one that is depressible or compressible when you press on the mass itself. One suspects the presence of cancer in the following situations: presence of a dominant breast mass with telltale or giveaway signs of malignancy, which consists of signs of local invasion and signs of spread. Or the other scenario in which you should suspect presence of cancer is the presence of sanguineous nipple discharge with an accompanying breast mass, as shown here. Cancer is suspected if there are signs of local invasion of the breast mass on the adjacent tissues, as exemplified by the following: fixation to the adjacent tissues, such as the overlying skin, inclusive of the nipple and areola, and the underlying tissues, such as the chest muscles and ribs, and skin changes over the mass that are suggestive or indicative of local invasion, such as ulcerations and fungations. Then signs of spread. So what constitutes signs of spread? The presence of palpable ipsilateral, meaning on the same side of the breast mass. Okay. Axillary or armpit lymph node, and supraclavicular mass. Supraclavicular means above the collarbone. Okay. So these are usually lymph nodes. So signs of spread will be the lymph nodes and the axilla, the armpit, and also the supraclavicular area. What is ROJoson's advocacy program on BSE? ROJoson's advocacy program on BSE dated as far back as 1982, a year after he graduated from his general surgery residency program from the Philippine General Hospital and started managing patients with breast concerns. He believes that BSE is the most practical way and very useful and economical at that to detect breast cancers among Filipina, because breast cancers is very common among the Filipina or Filipino women. With his more than 40 years of experiences in the management of Filipina with breast cancers, he does not subscribe to using routine or regular mammogram nor ultrasound of the breast as a screening tool for breast cancers. And the reasons he gives is that main reasons, he has seen a lot of inconclusive reports on mammogram, a lot of false positive reports on ultrasound of the breast, and false negative reports. Additional reason, most patients cannot sustain a practice of regular mammogram and ultrasound because of the inconvenience and also the cost. So the other reason why Dr. Joson has a stand against routine screening with mammogram, and this has been validated recently by the Ukraine adoption of early diagnosis program over screening program with the blessing of WHO. So there's a WHO publication entitled Better Than Screening, which is the early diagnosis program. So with the WHO's help, Ukraine chose a cost-efficient policy to prevent breast cancer. The other reason or the other validation for the stance of Dr. Joson against routine screening with mammogram is this paper recently published in August 2023. The title is Estimated Lifetime Gain with Cancer Screening Tests, a randomized meta-analysis of some randomized studies. The result shows that current evidence does not substantiate the claim that common cancer screening tests save lives by extending the lifetime. And the test included here are the worthy mammogram. In 2022, last year, ROJoson created a program called the BSE Awards under the Cancer Crusaders Club, in which it would give cash awards as incentives to the Filipina who would do regular BSE for at least 9 months. The primary objective of the club or the BSE is to promote early detection of breast cancers among Filipino women. The awards were given to 65 BSE promoters and practitioners last year. So a total of 38,700 pesos were given out in December 2022. The awards still ongoing this year in 2023. This is a sample of the certificate of commitment given to a Filipina who completed the course requirements of the breast self-examination, a health habit to cultivate. And then this year, or the plan for 2024, but this will be initiated before the end of this year. One is to entice and invite Filipina to learn how to do BSE and how to interpret findings, and then take the online learning curve evaluation test exercise. And then OLETE passers will get certificates of commitment and accomplishment, certificates of proficiency, and certificates of mastery. An example of a certificate of commitment and accomplishment, this will be given on the first try, and then on the second year, certificate of proficiency, and then on the third year, certificate of mastery. So summary and takeaway, I have presented all these topics. What is breast self-exam? Why is breast self-exam a must-do for all Filipina? Why is screening mammogram not a must-do for all Filipina? How to do BSE? How to interpret the findings in BSE? And what is ROJoson's advocacy program on BSE? BSE is a must-do for all Filipina because BSE as a health habit is simple and without cost. It can be repeated anytime without added cost. It can be done anytime and anywhere. It can detect breast cancer and other breast diseases. It can detect early breast cancer as long as it is done regularly and properly, and as long as it is reported to a breast specialist early enough. So it's important to consult the breast specialist right away once a dominant mass is detected during BSE. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on breast self-exam. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on breast self-examination as a must-do for all Filipina in your health management. With that, I end my pep talk. Breast self-examination, a must-do for all Filipina. I hope I have empowered you to have an essential understanding of breast self-examination as a must-do for all Filipina in your health management. Thank you for your kind attention and good day.